Hello everyone. Am I clearly visible, audible? Give me a thumbs up in the chat box if I'm clearly visible, audible. I will start the lecture ahead. Okay. Give me a minute to confirm if I'm clearly visible, audible. I will start the lecture. Okay, just a second. So yeah, I hope it is working. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here. And today I'm here to take my series Pathology Rapid Fast Revision for NEET PG. I'm going to take every day one system of systemic pathology and cover the important topics in that system from competitive exam point of view, right? So yesterday we have taken cardiovascular system and covered the various types of endocarditis in that. Today I am teaching you respiratory system. Right? So in respiratory system, we will cover all the important topics here. So I will teach you pneumonias, the various types of pneumonias, and all the MCQs based on that, the various types of COPDs. In COPDs, I will teach you basically 4 COPDs. So I will teach you bronchiectasis, chronic bronchitis, emphysema, and asthma. So these 4 COPDs we are going to discuss in details, and lung cancer. So these are the 3 topics in respiratory system you can't afford missing before going to your exam. I guess all the students who are targeting NEET PG or FMG, they should know these 3 topics from the respiratory system in pathology. So I will come on pneumonias first, then COPDs, then lung cancer, right? If you have any specific choice of pattern, you can let me know. Okay. So before that, I would like to give you a brief idea. In the first 5 minutes of the lecture, I will give you a brief idea about the anatomy, histology, and physiology of the respiratory system. So let me start with respiratory system. We know humans have a pair of lungs. We have 2 lungs, the right lung and the left lung. In the right lung, we have 3 lobes. You can see upper lobe, middle lobe, and lower lobe. But in the left lung, we have only 2 lobes, upper and lower. So where is the middle lobe of the left lung? The middle lobe of the right lung is larger. Of course, we can see right lung is having 3 lobes. It is having upper, middle, and lower. But in left lung, only 2 lobes are present. It is smaller, right? The middle lobe of the left lung is represented by lingula. It is represented by lingula. It is an MCQ. It is a previous year question in your papers. So the middle lobe of the left lung is represented by a small lingula. So take consideration of this lingula, right? Now we divide the entire respiratory tract into 2 portions, the upper respiratory tract and the lower respiratory tract, right? Okay, so what is that? I would like to draw it for you. So see, okay, you can see the nose, you can see the mouth, right? So nose opens in nasopharynx and the mouth opens in oropharynx. So this is pharynx, both open in pharynx, common pharynx, the hypopharynx. So this is nasopharynx, you can see, this is oropharynx, you can see, and this is hypopharynx. So this is pharynx, right? So we take air from nose also, from mouth also. So all the air go in pharynx. From the pharynx, the air goes in larynx. So this is larynx. This is larynx. Larynx opens in trachea. You can see the trachea. The trachea divide into 2 bronchi, the right and the left bronchi. Bronchi divide in bronchioles. Till now, it is pharynx, pharynx के बाद larynx, larynx के बाद trachea, trachea divide in bronchi. Bronchi, the right bronchi and the left bronchi, the 2 principal bronchi. Bronchi will divide into bronchioles. So bronchioles will be primary bronchiole. Primary bronchiole will give rise to secondary bronchiole. Secondary will give rise to tertiary. Tertiary will give rise to terminal. Terminal will give rise to respiratory bronchiole. Respiratory. So let me write till here. So it is primary, secondary, tertiary. Tertiary के बाद आएगा terminal. Terminal के बाद आएगा respiratory bronchiole. Respiratory bronchiole give rise to alveolar ducts, and alveolar ducts give rise to alveolar sac. Alveolar sacs are the last structure. This is alveolar duct, this is alveolar sac. Alveolar sac also known as alveoli. Alveoli. That is the last structure in the form of the balloon. So this is the entire lung. You can see the entire lung. Please see. So see the complete thing. It starts from mouth. It starts from nose and mouth. Okay. So this is nose, this is mouth. So starting from nose and mouth, what is the complete? So it is nose, nasopharynx, hypopharynx, larynx, trachea, bronchi, primary bronchiole, secondary bronchiole, tertiary bronchiole, terminal bronchiole, respiratory bronchiole, alveolar duct, alveolar sac. So ultimately air, whatever air you are inhaling, imagine this is air. Air containing fresh oxygen. It is going inside, here. All the air reaches in the alveoli, the alveolar sacs. What happened next? Why we are taking this air? We want to take this air for Exchange. We want to take oxygen from the air and exhale carbon dioxide in the air. So all the alveoli are covered by blood capillaries. So let me draw a blood capillary covering this. So this is a blood capillary covering this alveoli. This is a blood capillary covering this alveoli. Have you got it? Everyone give me a thumbs up. So this is the endothelial cells of this capillary. This is the so capillaries are lined by endothelial cells. This is the endothelial cells of this capillary. And what is the lining of this alveolar sac? The alveolar sac ka lining kya hai? The alveolar sacs are lined by pneumocytes. The two type of pneumocytes, type 1 and type 2, right? So you are taking the air. This is air. So whatever air you are taking, it is going in the nose, in the pharynx, in the larynx, in the trachea, in the primary bronchi, primary, secondary, tertiary, terminal, respiratory, alveolar duct. Finally, it reaches the alveolar sac. In the alveolar sac, whatever oxygen present, it will go in blood, and whatever carbon dioxide present in blood, it will come in the alveoli. And again, the reverse will take place and carbon dioxide will come out. So you are doing inhalation and exhalation using this route. So in inhalation, oxygen is going inside, doing the exchange, and in exhalation, carbon dioxide is coming out. Again, the process is repeated. So we constantly do inhalation and exhalation. So basically, exchange takes place at this level. At this level, exchange takes place. Give me a thumbs up. Everyone give me a thumbs up. Till now, you got this point? Yes or no? The last three things. Okay, let me divide the entire respiratory tract into upper and lower. Upper में क्या क्या आता है? Upper में आती हैं 4 things. So it starts from nose, pharynx, and larynx. Till here, it is known as upper respiratory tract. Upper respiratory tract. And from trachea onwards, we have lower respiratory tract. So trachea, bronchi, all the bronchioles, primary, secondary, tertiary, terminal, respiratory, alveolar duct, alveolar sac. ये पूरा lower respiratory tract है, right? So you should understand what diseases are of upper respiratory tract, what diseases are of lower respiratory tract. Please understand. Give me a thumbs up. That is the first thing. The second thing, exchange takes place at what level? Gaseous exchange कहाँ हो रहा है? So here gaseous exchange takes place. So air is crossing what? So let me draw it. You got this point? You got all this diagram? Give me a thumbs up. Should I remove this diagram? I cannot come on this again. Once I will remove it. Give me a thumbs up if you got this. Okay. So what is the complete? So same thing is written in front of you. So trachea divides into bronchi. Bronchi divides into bronchiole. Primary, secondary, tertiary. Then terminal bronchiole. Then respiratory bronchiole. Then alveolar ducts. And then alveolar sac. So this is the same diagram which I have drawn for you. You can see this is trachea dividing into bronchi. You can see the primary, secondary, and tertiary bronchioles, right? The same diagram which I have drawn for you. The last structure is the balloon-like structures, that is alveolar sac. Can you see the multiple balloons? These balloons-like structure are alveolar sacs or alveoli. These balloon-like structures are alveolar sac or alveoli. Give me a thumbs up. Everyone give me a thumbs up. So same story is given multiple times. Okay. So you have to write the complete tree. Start from nose. From nose it is pharynx. From pharynx it is larynx. From larynx, what is there from larynx? From larynx it is trachea. The trachea divide into two bronchi. The primary bronchi right and left. Bronchi divide in bronchioles. Primary, secondary, tertiary, terminal. Right? These are the bronchioles. Then respiratory bronchiole. Then alveolar duct and then alveolar sac. What is my point here? These are the bronchioles. Primary bronchiole, secondary, tertiary, terminal and respiratory. Right? The last three things. Respiratory bronchiole, alveolar duct and alveolar sac. These three things together known as acinus. Acinus is the functional unit of the lung. Like glomerulus is the functional unit of the kidney for the lung. This is entire lung. So in the entire respiratory tree, this is entire respiratory tree. In the entire respiratory tree, it starts from nose and it goes inside up to the acinus. Acinus, the last three things is known as the functional unit of the lung. Give me a thumbs up. Everyone give me a thumbs up. If you got the basics, give me a thumbs up. Let me tell you the exchange and start with pneumonias now. Now you will get it. So that is acinus. The last three things together is known as acinus, right? Now, so this is acinus. This is respiratory bronchiole, you can see, and this is alveolar ducts, and from which the balloons alveolar sacs are arising. So these three things together is known as acinus. You can see the acinus here. So acinus is nothing, the last three things together. So distal to the terminal bronchiole, the three things. Terminal bronchiole not including उसके बाद की तीन चीजें. So respiratory bronchiole, alveolar duct, alveolar sac. That is known as acinus. So this is the diagram of acinus. Respiratory bronchiole, alveolar duct and alveolar sac. So this is a acinus. One acinus. Acinus is the functional unit. You got it. So this is the entire tree. You got what is acinus. So you got the basics, right? Okay. So one more thing before starting the pneumonias, I would like to tell you is that I have already taught you in the beginning what is a lobe in the lung. Human have two lungs now. So this is right lung of the human and this is left lung of the human. I have already taught you this is trachea and these are the bronchi. Bronchi will divide into bronchiole and also inside the lungs. Okay. So right lung is divided into three lobes. So this is upper lobe, this is middle lobe, this is lower lobe. These are lobes, L-O-B-E-S, lobes. The left lung is divided again into two lobes, upper and lower. Left me there is no middle lobe, it is in the form of the lingula. Again, these are lobes. So I will teach you pneumonia. Pneumonia is of two types, lobar and lobular. I will teach you two types of pneumonia. So before starting pneumonia, I should teach you lobar. Okay, just a second. See here, lobar pneumonia and lobular pneumonia. So lobar pneumonia is some pneumonia which involve the entire lobe. If entire lobe is having pneumonia, either entire upper, entire lower, entire middle, any entire lobe is showing consolidation, it is known as lobar pneumonia. So in lobar pneumonia, the point is that entire lobe is involved and you know what is lobe. Total 5 lobes are there. One of the entire lobe is involved. So that is lobar pneumonia of upper right, upper middle, middle right, lower mid, so like that. But what is lobule? My point is that what is lobule? Before starting pneumonia, I should explain you what is a lobule. In lobular pneumonia, lobule is involved. So you should understand what is lobule and after that I will start the two type of pneumonias. Give me a thumbs up. Everyone give me a thumbs up. So what is a lobule? Can anyone of you tell me, Dr. Priyanka or anyone of you who is watching me live, can tell me what is a lobule? You know what is a lobe. You already know what is a lobe. Lobes, you know there are 3 lobes in the right lung and there are 2 lobes in the left lung. That is lobe. So we divide the lung into anatomically various portions, that is a lobe. But I want to ask you what is a lobule? What is a lobule? Does anyone tell me what is a lobule? Pulmonary lobule. Lobule kya hota hai? What is lobule? So I have told you the complete distribution. Do you know it? Yes or no? If you don't know, write down. You don't know. So, okay, I will tell you. So take 3 to 5 terminal bronchioles. Take 3 to 5 terminal bronchioles. Can you see? This is terminal bronchiole. So this is terminal bronchiole. So primary, secondary, tertiary. After that, there is terminal bronchiole. Take 3 to 5 terminal bronchioles. This is the diagram. I will also draw it for you. So, okay, let me teach you the complete, let me tell you the complete tree again. Complete tree फिर से बोलो. Start from the nose. Nose के बाद क्या है? There is pharynx, there is larynx, there is trachea, there is bronchi, the primary bronchi, right and left. Then there is primary, secondary, tertiary bronchiole. Then terminal bronchiole, I am talking about this. Then respiratory bronchiole and then alveolar duct and then alveolar sac. The last 3 structures together is known as acinus. I am not interested in acinus right now. What I am telling you, take 3 to 5 terminal bronchioles. Not 1, 3 to 5. Let me draw. Let me draw 3. Let me draw 3. So this is one tertiary. From one tertiary, I am drawing 3 terminal bronchioles. 1, 2, 3. Understand? Lobule understanding बहुत difficult है, but I will try. So these are 3 terminal bronchioles. Can you see? I have used a color. So this is a terminal bronchiole. This is also a terminal bronchiole. This is a terminal bronchiole. You can see from one terminal bronchiole, multiple respiratory bronchioles will arise. So let me draw the respiratory bronchioles. Imagine from one, multiple are arising. 1, 1, 2, 2, 3, 3 respiratory bronchioles are arising. So these green color are the respiratory bronchioles, right? These green color are respiratory bronchioles. Give me a thumbs up. These are the respiratory bronchioles. And you can see from one respiratory bronchioles, multiple alveolar duct and multiple alveolar sacs are arising. So let me draw multiple alveolar duct from one respiratory bronchiole. Multiple alveolar duct. I cannot draw for all of them, but you can imagine. So these are the multiple alveolar ducts. The red one are the alveolar ducts. And from them, lastly, the alveolar sacs are there. Multiple alveolar sacs are there from one duct. कहने का मतलब एक टर्मिनल ब्रोंक्यूल से मल्टीपल रेस्पिरेटरी है, एक रेस्पिरेटरी से मल्टीपल एल्वुलर है, एल्वुलर डक्ट है, एक एल्वुलर डक्ट से मल्टीपल एल्वुलर सैक्स है. So multiple alveolar sacs are there. So in the end, we are having multiple alveolar sac, right? Now this is known as one lobule. This is one lobule. So it is defined as, just a second, I cannot see your chat. I have to do the re-entry. Just a second. Can you see me? Can you hear me? Okay. This is defined as 3 to 5 terminal bronchiole. Terminal bronchiole 1, 2, 3. 3 to 5 terminal bronchioles along with their all appendages. Along with their. So 3 to 5 terminal bronchiole में से जो भी निकलेगा. So all respiratory bronchiole, alveolar duct, alveolar sac together constitute one lobule. So this is one lobule. One lobule. So 3 to 5 terminal bronchiole along with their all appendages. That is the definition of a lobule. I want thumbs up from everyone. Shivam, you got it? So you can see 2 terminal bronchioles here. So can you see a terminal bronchiole? This one and this one. So from this, everything arising constitute one lobule. So let me draw a lung. Okay. So where they are present in the lung. So you got it. So take 3 to 5 terminal bronchioles and all the appendages from them will constitute one lobule. Okay. Let me draw 2 lungs here and 2 lungs here. Just a second. So these are the 2 lungs, right and left. Right. This is trachea and these are the 2 bronchi. This is right lung. This is left lung. The same diagram I am drawing here. In the first diagram, tell me the lobes. In the second diagram, tell me the lobules. That's it. I want to tell you. So here this is right lung. Here this is left lung. So let me teach you about lobes. Let me tell you the lobes. You already know lobes. In this diagram, you draw lobes. In this diagram, you draw lobule. That I want to teach you. That I want to tell you. So in the first diagram, the lobes in the right lung, we have 3 lobes. This is upper, middle, lower. In the left, there are only 2 upper and lower. So total 5 lobes are there. It's very simple to draw them. It's very, very simple to draw them, right? What about lobule? How you will draw the lobule? You will say, ma'am, I know the definition of lobule, that it is 3 to 5 terminal bronchiole along with all the appendages it is having. All the respiratory bronchiole, alveolar duct, alveolar sacs, all the acinas it is having. So all 3 to 5 terminal bronchiole constitute one lobule. So where it is present in the lung? My point, where it is present in the lung. So in the present, maybe it is one lobule, it is one lobule, it is one lobule, one lobule, it is present haphazardly anywhere. So inside each of them, it is having 3 to 5 terminal bronchioles along with their appendages. 3 to 5 terminal bronchioles along with their appendages. Am I visible and audible to you? I cannot see your chat every time. Am I visible and audible to you? Give me a thumbs up if I am clearly visible, audible. Am I clearly visible, audible? Okay. Okay. I guess I am. So what is my point here? Listen, what is my point here? The lobes are continuous. The lobes are continuous. That they are continuous. You can see this is continuity. It is in continuation. It is in continuation. So if lobar pneumonia is there, consolidation is continuation. Right? It is continuous. But lobule is, patchy. This is known as diffuse. This is known as diffuse consolidation. This is known as patchy consolidation. So the 2 type of pneumonia. In lobar pneumonia, lobes are involved and consolidation is diffuse. One of the entire lobe is involved. But in lobular pneumonia, lobules are involved and consolidation is patchy. So you can see multiple patches in the X-ray. So if you are having an X-ray having diffuse involvement of one of the lobe, it is lobar pneumonia. And in the X-ray, multiple patches of consolidation are there. It is lobular pneumonia. So that is the 2 type of pneumonia. Give me a thumbs up. Should I start now pneumonia? Should I start pneumonia? I should start. Okay. So I'm not coming on the histology. You already know the histology and you already know this everything. So let me start with pneumonias. Let me start with pneumonias. Before coming to the pneumonias, I would like to tell you one more thing, the collateral airways. Yeah, what is collateral? इस पे भी बहुत MCQs आते हैं. What is collateral airways? Okay. See this diagram. You can see these are the 2 alveolar sacs, the final balloons, the alveolar sacs. These are the 2 alveolar sacs. From where alveolar sacs are arising? From where alveolar sacs are arising? They are arising from alveolar ducts. So these are the alveolar ducts or respiratory bronchiole, and this is the respiratory bronchiole. So you can understand the diagram, right? Now my point is that whether the 2 alveolar sacs are connected with each other? Yeah, they are connected via pore. This pore is known as pore of Cohen. So what is pore of Cohen? It is interalveolar, between 2 alveolus, interalveolar connection. Alveolus connection. That is pore of Cohen. Give me a thumbs up. Give me a thumbs up. My second point is that this is a bronchiole. This is a bronchiole. Both are respiratory bronchiole. Respiratory bronchiole. So are the bronchioles connected with each other? Yes. You can see a pore between them also. This is known as channel of Martin. So channel of Martin is interbronchiolar connection between 2 bronchioles. Bronchiole. My third point is that. My third point is the alveolus is connected to the bronchiole by some channel. Yes. So alveolus is connected to the bronchiole by third channel, that is known as channel of Lambert. So it is known as bronchioalveolar connection. So there are 3 type of connections. What are the 3 type of connections? Interalveolar, interbronchiolar, and bronchioalveolar. So these are between 2 alveoli, between 2 bronchiole, and one is between bronchiole and alveolar. They have specific names. What are the specific names? This is known as pores of Cohen, right? This is known as channel of Lambert, and this is known as channel of Martin. Am I right कि गलत बोला मैंने? Channel of, मैंने उल्टा बोल दिया, Martin and Lambert. Give me a thumbs up. Everyone give me a thumbs up. Everyone, I tried best. So what is pore of Cohen? Pores of Cohen are interalveolar connection between 2 alveoli. Alveoli, between 2 alveoli. What are channel of Martin? between two bronchiole. So interbronchiole, between bronchiole. And what are channel of Lambert? Channel of Lambert is bronchioalveolar. Between one bronchiole, between one alveolar. Give me a thumbs up. So alveolar, bronchiole, bronchioalveolar. You tell me the three names. What are the three names? So alveolar is Cohen. It is known as Cohen. Bronchiole is Martin. It is known as Martin. And bronchioalveolar is known as Lambert. It is known as Lambert. Now, three MCQs are in front of you. You can imagine how beautifully the examiner can frame MCQs on these. And pores of Cohen pe to already aa chuka hai. It is a previous year question. But the rest of the two are not yet asked, but anytime anyone can ask you this question. Now, the question can be image-based. It can be an image-based question. The labeling can be asked, and the question can be a theory question. Everyone give me a thumbs up. Everyone give me a thumbs up. Everyone. Everyone means everyone. You got it? So these are the collateral pathways. After collateral pathways, I would like to start with pneumonias now. I would like to start with pneumonia. So let me start the pneumonias. Let me start the diseases. Let me start the pneumonia. Can any one of you tell me the definition of pneumonia? Tell me the definition of pneumonia. What is pneumonia? Can any one of you? Shivam, Gayatri, Priyanka, Amritesh, anyone? What is pneumonia? Okay, let me ask specifically. Ammonia is inflammation of the lung. Everyone knows that. But don't tell me a layman language. You are a student. You are an MBBS student. Actually, you are a doctor now. So tell me a medical language of pneumonia. Medical definition of pneumonia. Don't say, ma'am, it is the inflammation of the lung. Lung? Which portion of lung? It is the inflammation of the respiratory tract. Respiratory tract? Come on, tell me specifically. Which portion? So is it inflammation of the nose? Is it inflammation of pharynx? Larynx? So nose, pharynx, larynx, then उसके बाद trachea. Trachea के बाद क्या आता है? It is bronchi. Bronchi के बाद क्या आता है? Primary, secondary, tertiary, terminal, respiratory. Bronchiole. These all are bronchiole. Bronchiole के बाद आता है alveolar duct, then alveolar sac. Now tell me where is pneumonia? You tell me where is pneumonia. Specifically कौन बताएगा? Where is pneumonia? Pneumonia is inflammation of which portion? Inflammation of which portion? Is it inflammation of nose, pharynx, larynx, trachea, bronchi, bronchiole, alveolar duct, alveolar sac? Which portion of lung is inflammation is known as pneumonia? I'm asking you. No one is replying. No one is replying. So Gayatri is saying inflammation of lung parenchyma. That's what Gayatri I'm saying. So being a medical student, Dr. Gayatri, you are a doctor now. So you have to tell me medical language of pneumonia. This is a layman language. Yes, inflammation of the lung. If you ask a 12th standard student, he will also say it is an inflammation of the lung. But being a doctor, you tell me which portion of the lung. Gayatri, which portion of the lung? Or anyone else, which portion of the lung? You know it specifically? Okay. It is inflammation of the acinus. It is inflammation of the acinus. So inflammation of respiratory bronchiole, alveolar duct and alveolar sac is known as pneumonia. Don't say inflammation of the lung. Okay, it is inflammation. These all are portions of the lung now. So specifically, it is the inflammation of acinus. The last three portions are known as acinus. So how you will say the definition? You say, ma'am, it is inflammation of the lung. Very good, Gayatri. Beyond terminal bronchiole. Very good, Gayatri. Very good. It is beyond terminal bronchiole. So beyond terminal bronchiole, we have three things. That is respiratory bronchiole, alveolar duct or alveolar sac. It is the inflammation of that. So in all the diseases, I will teach you chronic bronchitis, I will teach you emphysema, I will teach you asthma, I will teach you bronchiectasis, I will teach you bronchiolitis. These are the 5 types of COPDs I am going to teach you after pneumonia. So in each disease, I will draw this tree. In this tree, you have to mark the label. You have to label the position. What is the level of this disease? Like chronic bronchitis, it is a disease of trachea and bronchi. Emphysema, it is again a disease of acinus, like pneumonia. Asthma, again it is a disease of trachea and bronchi. So you have to tell me the level. You know, bronchiectasis, it is a disease of bronchioles. So you have to tell me the level. कौन सी disease किस level की है? You should know all the hierarchy. This is known as hierarchy. Starting from nose, going down till acinus. So all diseases have different levels. Of course, these all are respiratory tract disease. That's why the diseases of the lung. Give me a thumbs up. Everyone give me a thumbs up. So the correct answer, what is pneumonia? You got it. So pneumonia is inflammation of the lung. Okay. Distal to terminal bronchiole. Not including terminal bronchiole. Distal to that. Terminal bronchiole नहीं include कर रही हूँ. उसके बाद, उसके distal. So उसके distal we have 3 things. Respiratory bronchiole, alveolar duct and alveolar sacs. That is known as acinus. So in short, pneumonia is inflammation of acinus. Can I say? Inflammation of the acinus in the lung is known as pneumonia. So basically it is known as consolidation of the lung. Give me a thumbs up. It is known as consolidation. So it is the pneumonia is a disease of this portion. This portion. It is not a disease of this portion. It is a disease of acinus. That is pneumonia, inflammation. So how does the inflammation will take place? For causing inflammation, the microorganism, I will talk about 3 microorganisms now. Microorganisms. Microorganism can be bacteria, which can cause pneumonia, bacterial pneumonia. It can be virus. It can cause pneumonia, viral pneumonia. It can be a fungus, the fungal pneumonia. Parasites don't cause pneumonia yet, right? So bacterial, virus or fungus. I will teach you 3 types of pneumonias. Bacterial pneumonia. So any microorganism, how does it reach the acinus for causing pneumonia? What are the routes? For causing pneumonia, the organism should reach here, na? How does the organism reach? What are the routes? My next point is, what are the routes by which microorganism get entry into the lungs and reach the acinus? For causing infection, microorganism should reach here. So the most common route is inhalation. By inhalation, it is reaching. You know what is inhalation? Inhalation. The second route is blood. If bacteria is present in any portion of my blood, I'm having sepsis. Any patient is having sepsis. Sepsis means bacteria in the blood. So blood goes everywhere. Blood goes in the acinus also. So it will cause inflammation there. So via sepsis it can occur. It can occur by direct route. So lungs is in close position with the ribs. It is adjoining the ribs. So if bacteria or virus is present in the ribs or in the heart or in the muscles of the thorax, so they can directly enter the lung. So that is the direct spread. One of the spread is aspiration. What do you mean by aspiration? Aspiration का मतलब क्या होता है? Does anyone know the meaning of the aspiration? What do you mean by aspiration? Okay, I will explain you. See here. See here. Everyone see here. So you can understand this diagram, I guess. This is nasopharynx. Nose open in nasopharynx, mouth open in oropharynx, and both open in hypopharynx. Both of them open in hypopharynx. From hypopharynx, 2 things arises. Listen my point. Listen, very few students can understand this. From hypopharynx, at one point, larynx and trachea will arise. Larynx, which will give rise to trachea, which will give rise to bronchi, and the complete lungs will be formed. On the other side, hypopharynx will give rise to esophagus. And esophagus will open in the stomach, the complete GIT, the complete small intestine, the large intestine, this is GIT. Now we have 2 pipes here, the air pipe, the food pipe, right? So air pipe is this one. You can understand this is your air pipe. That is your trachea. This is your food pipe. That is your esophagus. So I'm assuming air pipe should have air and food pipe should have food, but both are arising from hypopharynx. Both are arising from hypopharynx. Now listen, from nose we take air only. I don't think anyone eats from the nose. I don't think so. But from mouth we take air as well as food. From the mouth we take both. So sometimes if my nose is blocked, I take the air by mouth. We all can do that, right? So usually we take the air from the nose, but sometimes we are mouth breathers. We take the air from our mouth and we take the food from the mouth, right? So air and food, both is going. In the nasopharynx there is only air, but in oropharynx we have both air and food. So both air and food got mixed here in the hypopharynx. In the hypopharynx we have air also, we have food also. This is normal. It is happening inside all of us. Yes or no? So I want air to go here, I want food to go here. So how it happens? Have you ever thought there is no problem if along with food air is also going in the esophagus? So whatever air going in the GIT, it will come out in the form of the flatus. It will come out in the form of the flatus. There is no harm in that. So it is a normal thing that in every human it happens to a small quantity, that is flatus. So flatulence can occur, but I cannot afford food here. If food is going here in the trachea, the food will cause pneumonia here. The food will cause infection here, and that is known as aspiration, that is known as pneumonia. Give me a thumbs up if you got. So this, the going of food here in the air pipe, it is known as aspiration. Aspiration. So how does normally the 2 things which are mixed in the hypopharynx, they got separated? How? So larynx is covered by epiglottis. It is covered by a covering which is known as epiglottis. So this epiglottis is always open, because every time I'm respirating, but every time I'm not eating. I'm eating only for few time, but non-stop while sleeping, while awaken, I'm respirating every time. So this epiglottis is always open for getting air in. But whenever you eat food, at the time of swallowing, this epiglottis closed. So food has only one route to go in the esophagus, but air always goes in the larynx, right? You got my point? So whenever you are eating or swallowing anything, at that time your epiglottis closed, to ensure that food should not go in the trachea. Otherwise, it is always open. It is open inside me right now. But if I swallow my saliva like this, so at the moment I am swallowing, it will close. Now, you should not talk and eat at the same time. You should not talk while eating. My mother always says, don't talk while eating. So I always ask my mother, why? Why we can't talk while eating? Why? So that is the scientific reason. If you talk also, if you eat also, your epiglottis will get confused. If you want to eat, it should close. If you want to talk, it should open. So it will get confused और तुम्हें लग जाएगा ठसका. The Hindi word ठसका लगना is aspiration. You got it? So aspiration में the food will got entry in the trachea and you can have the pneumonia. So inhalation, aspiration, blood route and direct route. These are the 4 routes via which bacteria or any microorganism can get entry in the lung. So that is the thing. So after pathogenesis, let me move ahead. Tell me the classification of pneumonia. How can you classify pneumonia? We can classify pneumonia by 3 ways. Number 1, based on the anatomy, based on the etiology, and based on the clinical settings. Okay, based on the anatomy, we have 3 types of pneumonia. Low bar pneumonia, in which lobe of the lung is involved. You already know what is lobe. Lobular pneumonia, in which lobule is involved. I guess everyone can understand what is lobe, what is lobule. मैंने अच्छे से समझा दिया है, right? So lobar pneumonia, lobular pneumonia. Lobular pneumonia is also known as bronchopneumonia. Broncho and lobular is one and the same thing. And third is interstitial. Interstitial is the background. Neither lobe nor lobule. It is the background. The background is known as interstitial. The background of the lung, right? So all the, can you see? This is a lung. This is a lung, right? So these are the lobes, the 3 lobes, right? These are the 3 lobes. Inside them, these are the lobules. The lobules are not continuous, they are patchy, right? But neither the lobe, neither the lobules see the background. The background, I'm marking the background. That is interstitium. The background is interstitium. So background is interstitial pneumonia. So there are 3 types of pneumonia. What are the 3 types of pneumonia based on anatomy of the lung? Based on anatomy of the lung, it is lobar pneumonia in which lobe is involved. There is lobular pneumonia, also known as broncho pneumonia, in which lobule is involved. And the third is interstitial pneumonia, also known as atypical pneumonia, in which the background is involved. Give me a thumbs up. That is based on the anatomy, the 3 types of pneumonia. Coming on the next classification, based on etiology. If pneumonia is caused by bacteria, it is caused by bacterial pneumonia. If pneumonia is caused by virus, it is known as viral pneumonia. If pneumonia is caused by fungus, it is known as fungal pneumonia. So I will teach you 3 types of pneumonia: bacterial, viral, fungal, based on etiology. The third classification, based on clinical settings. Based on clinical settings of the pneumonia. If pneumonia is occurring in any normal human being, it is known as community acquired pneumonia. It is occurring in the community acquired pneumonia. But pneumonia are very common in hospital. So some patient, just suppose there is a patient coming in the hospital with some other disease. He was not having pneumonia at the point of admission in the hospital. So due to some other disease, he got admitted in the hospital. But hospital is the most contagious place in the world. And he got infection in the lung there. Because other patients have pneumonia, other patients have cough, cold. From there, he got the infection and he got pneumonia in the hospital. So that is known as hospital acquired pneumonia. And that is known as nosocomial pneumonia. So second type is nosocomial or hospital acquired. The third is the patient on ventilator. Now in COVID, we use the ventilators. No? So ventilator associated pneumonia. It is very common because in ventilator, what you are doing? You are putting the lung under pressure. You are giving positive pressure in the lung. So there is more common wear and tear in the lung. That is the more, the patient more commonly have pneumonia. Right. So pneumonias are very common, the patients on ventilator. If you put the patient on ventilator for a long time, the patient can have pneumonia as a complication of ventilator. So that is known as ventilator associated pneumonia. Give me a thumbs up. Give me a thumbs up. Give me a thumbs up. So I'm coming on that. So, and Kian, you are asking, ma'am, apart from anatomical classification, how can we differentiate lobar and lobular pneumonia clinically? What is the difference? What is the treatment changes? I will come on all of your queries. Let me teach you these pneumonias in detail. Let me teach you your specific query. I will address it. Just listen my lecture for next 20 minutes. Then I will get you back whether you got your answer, yes or no. Right? Okay. So listen now. So let me finish the classification first. Okay. So classify pneumonia. Who will help me? The 3 types of classification of the pneumonia. The 3 types of classification first based on anatomy. That is the 3 types of pneumonia. Based on etiology. Again 3 types of pneumonia. Based on clinical settings. Again 3 types of pneumonia. So 3 here, 3 here and 3 here. Who will tell me the classification? Here it is lobar pneumonia, lobular pneumonia, that is bronchopneumonia. Learn other name also. And the third one is interstitial. Interstitial is background, that is atypical pneumonia. Learn other name also. Etiology made it's very easy. It is bacterial pneumonia, viral pneumonia, fungal pneumonia based on the infectious organism. Based on the clinical settings, again 3 type. It is community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia. Hospital acquired pneumonia also known as nosocomial pneumonia. Give me a thumbs up. If you got the classification, give me a thumbs up. That is the basics in the classification. So the three types, these two types are more important in classifying. The third clinical, okay, you can leave that. You should know, but you should leave. Okay. So let me combine these two classifications. The first two, okay. The first two classification. Listen, bacterial pneumonia can cause lobar also, can cause lobular also. So bacterial pneumonia can cause lobar or lobular. So I will teach you both. But viral pneumonia always causes interstitial or atypical. And fungal pneumonia also causes interstitial or atypical. You got my point? So I am combining the first two classification. So I am combining like this: bacterial pneumonia, viral pneumonia, fungal pneumonia. What I have taught you? Bacteria can cause two things. What the two things? Bacteria can cause lobar pneumonia as well as lobular or bronchopneumonia. So I will teach you both under bacterial pneumonia. Viral and fungal can cause only interstitial pneumonia. They cannot cause lobar, they cannot cause lobular. Viral and fungal can cause atypical pneumonias. Give me a thumbs up if these are the basics. You know, if you don't know the basics, I cannot directly jump on the histology of the pneumonias. You should know the basics. You should know that bacteria causes two types of pneumonia, lobar and lobular. These are the two types of bacterial pneumonia. But viral and fungal do not cause lobar and lobular. Come on, they cause interstitial pneumonia. These are the basics you should know. Let me start with bacterial pneumonia, the two types of bacterial, lobular and lobar pneumonia. Let me start. So as I have said you, bacterial pneumonias are of two types, lobar and lobular. Viral pneumonia, only one type, interstitial or atypical. Fungal is also same, interstitial or atypical. So let me start bacterial pneumonia. The two types of pneumonia, someone of you was asking the differences between them. Apart from anatomical difference, what is the difference? How we can differentiate? What are the clinical differences? What is the treatment? What is the prognosis? How we can differentiate the two types of pneumonias. So here I will explain you the two types of pneumonias in detail. Give me a thumbs up first, everyone. So should I start the two types of bacterial pneumonia? Are you people with me? Let me see your chat. I'm starting with the two types of pneumonia. Give me a thumbs up. Everyone give me a thumbs up. So I'm starting with bacterial pneumonia. So lobar pneumonia, lobes are involved. Lobular in pneumonia, lobule is involved, as I have told you. Yes or no? So see the lobar pneumonia and the lobular pneumonia. See, everyone see. Everyone see here. So in lobar pneumonia, entire lobe will be involved. Either upper lobe or lower lobe or middle lobe, any of the lobe, entire lobe. So it will be diffuse consolidation. It is continuous, it is diffuse. But in lobule, see the lobule here. So this is one lobule, this is one lobule, this is one lobule. What is a lobule? It is 3 to 5 terminal bronchioles along with its appendages. So it is patchy. It is patchy. You know the difference between lung lobe and lobule. So see the two types of pneumonia. See the two types of pneumonia anatomically. So you got it. This is lobar. The entire lobe is involved. No? This is entire lobe. It is consolidated. And this is lobular. This is lobular. That is, it is patchy. Patchy. So lobular, that is bronchopneumonia, is always patchy, and lobar pneumonia is diffuse. Both have consolidation. Consolidation of the lung. Consolidation means fluid in the lung. Lung normally have air. Instead of air, if it is having fluid, it is known as consolidation of the lung. So consolidation is diffuse, it is lobar pneumonia. If it is patchy, it is lobular or bronchopneumonia. Give me a thumbs up. The same diagram. The middle lobe is involved. Entire middle lobe is involved. So it is lobar. Here patchy consolidation is there. So it is known as lobular. Have you got it? Have you got it? See the gross. This is the gross. You can appreciate the gross of the two types of pneumonia. Every one of you. See, this is the normal lung. हाँ ये normal है. ऊपर normal color है lung का. See the lower lung become hard, yellowish, white. So entire lobe, it is lobar. Entire lobe is involved. Lower lobe, right? But see here, this area is consolidated. This is. I can find the patchy areas of consolidation. So of course it is broncho or lobular pneumonia. Give me a thumbs up. The same diagram. Entire lobe is involved and patchy consolidation is there. So here consolidation is diffuse. Here consolidation is patchy. That is the difference. You got it? Let me start with lobar pneumonia. Right? In lobar pneumonia, there are 4 stages. I will explain you all 4. In lobular pneumonia, only 1 stage is there. I will show you the histological diagram. If I take a biopsy here and if I take a biopsy here, diagram is absolutely different. Right? Let me explain you. Let me explain you the lobar pneumonia. Start with lobar pneumonia. As I have told you here, entire lobe is involved. Entire lobe is involved. It is frequent in adults. In lobular pneumonia, entire lobe, entire lobule is involved. And lobular is not common in adults. Lobular is common at extremes of age. Extremes of age yani either in infancy or in old age, not adult, right? So lobar is common in adult, lobular is common in extreme age. Lobar mein whole lobe is involved, That's why diffuse consolidation. Lobular mein lobule is involved. That's why patchy consolidation. Give me a thumbs up. So let me teach you low bar pneumonia, the etiology of low bar pneumonia. Most commonly, 90% of the time, it is caused by Streptococcus pneumoniae. Learn one bacteria, Streptococcus pneumoniae. Remaining 10%, it is caused by others. It can be caused by Staph pneumoniae, Streptococcus pneumoniae, right? And by gram-negative bacteria, Klebsiella, influenza, Pseudomonas, Proteus, E. coli. So these are rare. But most commonly, it is caused by Streptococcus pneumoniae. That is the etiology. Now, there are 4 phases. I am teaching you Lobar. In Lobar, there are 4 phases. What are the 4 phases? Stage of congestion, red hepatization, gray hepatization, and resolution. So I would like to explain you diagram for image-based questions on pneumonia. The diagram of the four phases. It's very easy to understand. Okay, we will start these phases one by one. It's very, very easy. Just give me 5 minutes. In the 5 minutes, we will complete the 4 phases of low bar pneumonia. And then we will come on lobular pneumonia. Lobular pneumonia don't have 4 phases. It have only 1 phase. So we will finish lobar and lobular in this way. So let me start with the 4 phases of the lobar pneumonia. So in the lobar pneumonia, the first phase is stage of congestion. The first phase is stage of congestion. It lasts for 1 to 2 days. 1 to 2 days. Here, grossly, see, the entire lobe is involved. The entire lobe is congested. It is reddish. It is congested. Congested means reddish is there. That is the gross. Microscopically, if you take the biopsy, see the biopsy. This is the biopsy of the lung. What you can see the biopsy? What are these circles? These are alveolus. These are alveolar sacs, the balloons, the last structure. The balloons are there. Alveoli or alveolar sacs are there. Right? Okay, I got it. These are the alveolar sacs. Let me see what is the pathology here. Let me draw it. Okay, can you see the blood capillaries? In between the sacs, these are the blood capillaries. All sacs are surrounded by blood capillaries for gaseous exchange. So these are the blood capillaries. What? Is it normal? No, it is not a normal diagram. What is the abnormality? Number 1, blood capillaries are dilated. I can see dilated blood capillaries are more dilated. Pulmonary capillaries are dilated. Number 1. Number 2, can you see the alveolar sacs? See the background of the alveolar sac. The background is not empty. It is containing a pink color fluid. See the background. It is having pink color fluid. See, appreciate the background. So what is that fluid? Normally it should be empty for gaseous exchange, no? But you will ask me, ma'am, it is not empty. It is having a pink color fluid, straw color fluid inside it. It is known as edema fluid. So it is filled with the edema. All the alveolar sacs are filled with edema. All the alveolar sacs are filled with edema. If you zoom the image, what is present in the fluid? You can find 2 types of cells inside the fluid. Number 1, you can find the neutrophils. All these are neutrophils. Can you see? These all multilobated cells are neutrophils. So few neutrophils are there and few RBCs. Can you see the RBCs? So few neutrophils with few RBC. Few. Mind the word few. So that is the only change in this image. 3 changes. Pulmonary capillaries are dilated. Alveolar sacs contain edema, the background pink color fluid, and it contains 2 type of cells. Few RBC and few neutrophil. That's it. This is first stage, stage of congestion. Take the snapshot of this image in your mind. That is stage of congestion. The first change, the first phase. Coming on the sex. So these are the, you don't learn it. So there is congestion of the capillary. There is edema fluid, pink color edema fluid. There is few RBC and few neutrophils. Few RBC and few neutrophils. And if you do the gram stain, you can find the bacteria also. The bacteria is also present. You will say, ma'am, where is the bacteria? I cannot see. You cannot see the bacteria on H&E. For seeing the bacteria, you have to do gram stain. If you do the gram stain of the same slide, you can find the bacteria inside them. So these are the Streptococcus. Can you see in chains? Streptococcus. So that is first stage. Coming on second stage, red hepatization. What do you mean by hepatization? Hepatitis word is liver. You will say, ma'am, come on, you are teaching us lung or you are teaching us liver? Lung के अंदर hepatization कैसे आ गया? Lung के अंदर liver. How you can find the liver inside the lung? I am teaching you lung. Pneumonia occurs in lung, not in liver. I am teaching you pneumonia. The phases of the pneumonia. It occurs in lung. So why I am saying hepatization? The word hepatitis is liver. So lung will look like liver. Actually, the lung, the consistency of lung will be like liver. Have you done dissection in your first prof MBBS? You may have done. So lung is spongy. You may have seen the lung of a cadaver. It is very spongy. It contains air. Have you palpated liver? Have you seen the liver of a cadaver? It is stony hard. It is stony hard. You cannot, it is not spongy. So the consistency is entirely different. It is like a sponge, it is like a stone, right? Here lung becomes stony hard because inside lung, there is no air now. The lung contains fluid now. It contains fluid, edema fluid and pus now. The lung contains pus now. So it becomes stony hard like liver. That's why it is known as hepatization of lung. What I am saying, the what? Hepatization of the lung. and the color is red. That's why it is known as red hepatization. So that is the second stage. You got it? So day 2 to 4, it is red hepatization. So see here the lung. The lung is red in color, but if you feel it, it is like liver. It is like hard, like liver, stony hard. That's why it is known as the lung is liver-like consistency. It is airless, it is dry, granular, heavy, and stony hard. Give me a thumbs up on this point. That is known as red hepatization. You got this point? Make a slide. This is the biopsy of this. See the biopsy. What you can see? You can see the alveoli. You can see the alveoli. What you can see inside the alveoli? Oh, come on, there is no edema now. Edema nahi hai abhi. What is there? Abundant of cells. Which cells? Again, the two type of cells. Maximum are neutrophils, multilobated if you zoom it out, and the other cells are RBC. So I found many RBC and neutrophils. In the last diagram, there were few RBCs and neutrophils. Now there are many RBCs and neutrophils filling all the alveolar sacs, and this is known as exudate now. Edema converted into exudate means pus. It is pus now. So all the alveoli are filled with pus. Initially there was edema, not converted into exudate. Give me a thumbs up. So that is stage 2. So in the stage 2, we have a exudate. We have exudate. So exudate means abundant of neutrophils and abundant of RBCs. Give me a thumbs up. The third stage is gray hepatization. Day 4 to day 8. Day 1 2 was stage of congestion. Day 3 and 4 red hepatization. 4 to 8 is gray hepatization, and day 8 onwards is the resolution. Right? So day 4 to day 8. Again, gray hepatization. Now the color is gray, but the lung is like liver only. The lung is like liver-like consistency. It is dry, granular, gray in color. See the diagram. So again, the lung, this is the lung. So lung is like liver. It is very hard, but it is gray in color. That's why known as gray hepatization. Now see the biopsy. See the biopsy. Which cells you see? You will see, ma'am, I can't see RBC. I can find few neutrophils. Neutrophils are decreasing now. Neutrophils are decreasing now. And instead of neutrophils, another cells are coming. What other cells are coming? Macrophages. Can you see these cells? If you zoom it out, single nucleus cell. So these all are macrophages. So neutrophils are decreasing and macrophages are coming. What are macrophages, by the way? Macrophages are phagocytes. Why phagocytes are coming? To eat the exudate. All the exudate is there, they will eat. They will engulf it. So everything will disappear, and last stage is resolution. So last stage, they will eat everything now, and last stage will come. The last stage is resolution, day 8 onwards. Day 8 onwards, there is resolution, and resolution means lung will become absolutely normal. Absolutely. Now see the spaces. See the spaces. Everything is disappeared. All the neutrophils disappeared, all the RBC disappeared, all the edema, all the exudate disappeared. Only macrophages are there. These macrophages are eating everything, and they will disappear also, and lung will become again inside the alveoli. You will find air. So that is the stage of resolution. Give me a thumbs up. So these are the 4 stages in front of you. I want thumbs up from everyone. You give me the revision of these 4 stages. What is there? What are the 4 stages of lobar pneumonia? Who will explain me the 4 stages of the lobar pneumonia? 4 stages. Rahul, I will show you the X-ray also. And the X-ray also, the same thing will be appreciated between lobar and lobular. I will show you the X-ray, don't worry. First, give me a thumbs up on this point. Have you got the 4 stages? Have you got the 4 stages? What are the 4 stages? Stage of congestion, stage of red hepatization, stage of gray hepatization, stage of resolution. You can see the gross finding of all of them. In congestion, the lung is red in color, but it is still like lung. It is spongy. In the second, the lung is red in color, but lung become like liver. That's why known as red hepatization. In the third, the lung become gray in color, and it is like liver. That's why known as gray hepatization. And in the last, the lung will become normal, absolutely normal. That's why known as resolution. The gross is complete. Now see the microscopy of each of them. In the microscopy here, inside the alveoli, you find edema fluid, you find few RBC and neutrophils. Here in the second, you find no edema, you find exudate. You find exudate. Edema is replaced by exudate. And instead of few, you find many abundant RBC and neutrophil in second stage. In third stage, RBC decrease, neutrophil decrease, and macrophage will appear, right? And exudate start decreasing. It start decreasing. Resolution, everything will disappear. Only few macrophages are there. They will do the phagocytosis, and everything is cleared up. Everything is cleared up. Now, I cannot simplify than this. Now, you can imagine how many beautiful image-based question the examiner can frame from the 4 stages. Examiner can give you diagram of any of the image, gross or microscopy, and can ask you the image, and can ask you the phase. This is a histological diagram of which phase of pneumonia. Is it stage of congestion? Is it stage of red hepatization, gray hepatization, or resolution? So based on the cells, what cells are present in that image? If there are few RBC and neutrophil, it is stage 1, stage of congestion. Many abundant RBC and abundant neutrophil, that is exudate is there, it is second stage, red hepatization. RBC and neutrophils are decreasing and few macrophages are there. So stage 3, that is gray hepatization, and only macrophages are there, that is doing the phagocytosis, that is resolution. So based on the cell, you see the cell and decide the stage. Decide the stage, that is the summary of this. You can get IBQ also, you can get theory question also based on the 4 phases. This is the timings. Timings में भी बहुत question आता है. Stage of congestion lasts for day 1, day 2. Red hepatization for the next 2 days, day 2 to day 4. Gray hepatization is day 4 to day 8, and resolution day 8 onwards. Day 8 onwards, if you are not giving any antibiotic, but if you give the antibiotic to the patient, these phases will be faster and recovery will be fast. If you don't give the antibiotic, this is the natural course. This is the natural course. Right. Last is scarring. No, there is no scarring in pneumonia. It is not TB. NKN. In TB, we have in the end, we have a scar. There is no scarring. Pneumonia absolutely cleared. There is no remnant of pneumonia in the lung. If any patient is having pneumonia in the past and it is already treated, if you see the X-ray now, there is no scarring of pneumonia. There is no scarring of pneumonia. It is absolutely cleared. Stage of resolution में absolute clear हो जाता है. Like normal lung, the previous lung. You got my point? NKN, you got my point. So there is no scarring. There is no scarring in the pneumonia. We got low bar pneumonia. The 4 stages of low bar pneumonia. Stage of congestion, stage of red hepatization, gray hepatization, and resolution. Let me teach you lobular pneumonia. Lobular pneumonia, bronchopneumonia, only 1 stage is there. There are no multiple stages, only 1 stage. So it is very small. Lobular pneumonia or bronchopneumonia, right? Here, the lobule is involved. Lobule means 3 to 5 terminal bronchioles, right? It do not occurs in adults. It occurs in extremes of age, either in infancy or in old age, right? And it occurs as a, you can see the difference. This is lobar, it is diffuse. This is lobular. I'm teaching you this one now. Bronchopneumonia, it is patchy. It is patchy. Same occurs with the X-ray also, right? So that is the thing. Here it is a mixed infection. It is due to mixed infection. It is not due to 90% due to Streptococcus pneumoniae like the the lobar pneumonia was there. In lobar pneumonia, most common organism is Streptococcus pneumoniae or Pneumococcus, one and the same thing, right? But here mixed infection is there. From all these, it is mixed infection, right? Grossly, here patchy. The word important here is patchy. You will get patchy areas of consolidation, not continuous. It is patchy. The word here is patchy. Here it was diffuse. In lobar it was diffuse, but here it is patchy. Patchy. It is usually bilateral. You can see it involves lower lobe. I have drawn it in lower lobe. So it is more common in lower lobe. It is more common. You can see this diagram. This diagram can come in the form of IBQ in your exam. You can see this patch, this patch, this patch, this patch. So it is patchy. It is patchy. All the diagrams are from Robbins, right? See patchy. See patchy. Now these all can come in the form of IBQs. Various questions can be framed. First, you should identify what it is. It is pneumonia. Which pneumonia? Lobular pneumonia. Now based on this, any question can come in your exam. Give me a thumbs up. So if you make a slide, only 1 slide is there. There are no 4 phases. There is 1 phase. So this is the slide. This is the slide. So what is the definition of a lobule? So in lobular pneumonia, lobular or bronchopneumonia, as I have told you, a lobule is involved. What is a lobule? I'm asking you, what is a lobule? It is 3 to 5 terminal bronchioles. Involvement of 3 to 5 terminal bronchioles along with their all appendages, right? So if you take a biopsy from here, you will find at least 1 terminal bronchiole in the biopsy. So this is the diagram. See the diagram. In this diagram, can you appreciate what is this? What is this? This is a bronchiole, terminal bronchiole. What is this? This is a terminal bronchiole. You can't find this thing in the 4 phases there. In the 4 phases, in a lobar pneumonia, you were finding only alveolus. The multiple alveolus is there. Here in the center, you are finding 1 lobule. So that is the difference. Can you see a lobule here? Say yes at least. And apart from the lobules, these are the alveolar sacs. Surrounding the terminal bronchiole, these are the alveolar sacs. These are the various alveolar sacs surrounding the lobule. So in lobular pneumonia, the first pneumonia, not lobular, sorry. In lobar pneumonia, we were finding only sacs, alveolar sacs. There was no terminal bronchiole, but here we can find a terminal bronchiole also. So that is the difference. Based on the image, you can decide whether it is a diagram of low bar pneumonia or lobular pneumonia. In lobular pneumonia, in the terminal bronchiole, see the lumen. Lumen of the terminal bronchiole is completely filled with neutrophils. So it is an exudate, abundant of neutrophils. So it is exudate. It is exudate filling the lumen. Exudate present in the wall also, and exudate present in the alveolar lumens also. So everywhere exudate is present. So that is the only finding you can see. So it is acute bronchiolitis. Bronchioles are involved. Which bronchiole? Terminal bronchiole. And peribronchular, उसके आसपास जितने alveoli हैं, उसमें भी suppurative exudate है. So that is the only thing you can find. So that is the differences between the two types of pneumonia. So someone among you, I guess, NK, and you were asking what is the difference between them, no? So apart from anatomically, this is how we can differentiate lobar and lobular pneumonia. Let me finish. Lobar pneumonia, lobular pneumonia. Lobar pneumonia occurs in youngs and adults. Lobular pneumonia occurs at extremes of age, either infancy or old age, not adults. Lobar pneumonia most commonly caused by pneumococci 90% time. It is lobular pneumonia. It is not caused 90% by pneumococci like lobar. It is caused by mixed organism. Many organisms are there. Lobar pneumonia, if you see the gross, there is diffuse involvement of entire lobe. Here there is patchy consolidation. Multiple small patches are there. That is the biggest difference. Here 4 phases are there. 1, 2, 3, 4. Stage of congestion, red hepatization, gray hepatization, and resolution. Here only one stage is there in which terminal bronchiolitis is there. Terminal bronchiole is involved along with आसपास के peribronchular alveoli. Here resolution is very common. Here complications are common. Here it is good prognosis. Here it is having poor prognosis. Everyone gave me a thumbs up. Everyone. So lobar, I'm teaching you bacterial pneumonia. Still I have to teach you viral and fungal. Bacterial pneumonia, lobar pneumonia, the 4 stages. You already know the 4 stages. And lobular pneumonia have only 1 stage. These are the 4 stages of lobar pneumonia. This is only 1 stage of lobular pneumonia. So that's it. That's it. We are done with lobar and lobular. Everyone gave me a big thumbs up. Everyone. Everyone means everyone. Should I teach you viral and fungal also? Okay. Viral and fungal pneumonias do not cause lobar and lobular. They cause background pneumonia. That is interstitial or atypical. So let me start viral pneumonia. Viral pneumonia, it is also known as atypical pneumonia. Here also, you will have interstitial pneumonia. Lobe is not involved. No. Lobule is not involved. No. The background is involved. Background is involved. That's why it is known as atypical. Okay. So see the diagram. See the diagram. This is the biopsy. Okay. See this one. You will say, ma'am, what is it? Explain. Okay. Can you see what are these? I'm drawing the circles. These are alveoli. These are alveoli. Alveolar sacs. Alveoli. Right. You will say, ma'am, they are empty. They don't have edema fluid, the pink fluid. They don't have exudate. They don't have abundant of neutrophils, RBC inside them. They are empty. Empty means they have air inside them. They all are empty. They all are empty. There is no exudate inside them because here pneumonia is not present inside lobe or lobule. Pneumonia is present in the background. Now appreciate the background. In the background, zoom out the background. In the background, you can see the cells. These all cells are lymphocytes. यहाँ पे neutrophil नहीं आएंगे, या lymphocyte आएंगे. So basically, these all cells are lymphocytes and plasma cells. Lymphocytes and plasma cells are present in the background. The background. So background में pneumonia है. There is inflammation in the background, not inside the alveolus. So the main thing here, the alveolar sacs are empty. That differentiate viral and fungal pneumonia from bacterial pneumonia. In bacterial pneumonia, these are not empty. These are filled with exudate. Here, that's why it is known as atypical. You should ask them what is atypical about them. Why it is known as atypical? The atypical thing is that there is absence of alveolar exudate. The alveoli are empty. There is absence of alveolar exudate. So where is the inflammation? Inflammation is not inside the lumen of the exudate like lobar and lobular. Lobar lobular में उसके अंदर था. यहाँ पे inflammation is in the interstitium. That is in the background. That is in the background. Which is the most common virus causing viral pneumonia? The most common virus is RSV virus. Respiratory syncytial virus. इस पे भी MCQ है. Grossly यहाँ पे भी patchy areas मिलेंगे आपको. You will find patchy areas of consolidation. Histologically, this is the diagram. The most important thing is lack of alveolar exudate. It is a negative finding, but you have to say this negative finding. Lack of alveolar exudate, and then lymphocytes, macrophages, and plasma cells are present in the background. In the background, there are no neutrophils. There are no neutrophils. Give me a thumbs up. The same diagram. See, these spaces are empty. See the background. See the background. See, these spaces are empty. Spaces are empty. Appreciate the background. Let me zoom the background. I have zoomed the background. In the zoomed background version, you can see these all are lymphocytes and plasma cells and macrophages. I cannot simplify than this. Give me a thumbs up. So that is viral. Same as with fungal. Fungal immunocompromised person में होता है. फंगल हेल्दी पर्सन में कभी नहीं होता है. फंगल निमोनिया ऑल्सो नोन एज माइकोटिक निमोनिया. तो Pneumocystis carinii is the most common fungus which causes pneumonia. Pneumocystis. It usually occurs in HIV persons, that is a immunocompromised person. It is also interstitial pneumonia. That is background. So here also there is absence of alveolar exudate. So you can see the diagram. You can see the diagram. You will see, ma'am, this is the alveoli, but this is not empty. It contains the fluid. Yeah, it contains frothy fluid, but this is not edema fluid. It contains the fungus in the fluid. It contains the fungus and the interstitium, the background have the lymphocyte. If you appreciate, the background have the lymphocytes. The background have the lymphocytes, right? If you take this fluid out and do a fungal stain is pus stain. So you can see the fungus, the black color fungus. The black color, you can see the spores of the fungus. These are the spores, the black color spores on a pus stain. I have taken this fluid out. So these are the spores of the fungus. I am done. I am done with pneumonias. Give me a thumbs up. I am done with pneumonias. I am done. So let me stop here and rejoin the lecture on the app. Let me rejoin the same lecture on Unacademy app. A free lecture. Like YouTube only, it is a free lecture. Give me a break just of 5 minutes. After 5 minutes, I will continue the same lecture, pneumonias and COPDs on Unacademy app at 12:30 p.m. sharp. Just after 5 minutes, I will continue the same lecture. So take a break of 5-10 minutes. We will continue the same lecture on Unacademy app. Go to the Unacademy Learners app. You can see my lecture there. So Pathology Rapid Fast Revision episode number 4, Respiratory Pathology episode number 2 there. 1 we have taken there, episode 2 we are taking there, right? So you can find the link of this lecture in the description of this YouTube also. So you can directly join me on the Unacademy app after 5 minutes. Thank you very much for joining this lecture. I want everyone to come there. I'm going to teach you COPDs now. You can't afford missing COPDs. I will start with chronic bronchitis, emphysema, asthma, and bronchiectasis, bronchiolitis. I will teach you all. I will teach you all 5. The differences between all 5. You can't afford missing them. In a comparative manner, we will study. So please join me if you want to study COPDs in the next lecture. Join me on the app. You can't. And after that, if time allows, I will teach you lung cancer. So on the app, please join me. That is Respiratory Pathology episode number 2 on the app. It is free. Anyone can join it. Anyone can join it. You require a code to join it. The code is my surname, Sachdev10. SACHDEV, Sachdev10 is the code. Anyone, any medico in this world can use this code to unlock the free lectures on Unacademy. Any free lecture on Unacademy, you can unlock using this code. The free one, the plus one you cannot unlock. The plus one you can see via taking the subscription. Without taking subscription, any free lecture can be unlocked using this code. So please distribute this code to all the medicos throughout the globe so that everyone can get benefited of the free lectures available on Unacademy. So knowledge is free, right? It is flowing from everywhere. So everyone should get benefit of it. Thank you very much for being with me. I would like to join you back after 5 minutes. And okay, don't forget to give feedback about this lecture, everyone. And there are few announcements for you. So Unacademy mock test, NEET PG mock test is going to conduct on 17th April at 9 a.m. Right? Everyone should participate using the same code Sachdev10. Prof 1 is already out. The various plans for Prof 1 on Unacademy are out. You can take the subscription if you want to get prepared the subjects of the Prof 1. Right? If you take plus subscription, purchase plus subscription on Unacademy, you will get only Unacademy lectures. In Iconic, along with Unacademy, you will get Preparator also. So whatever of your choice, once you take the subscription, you will be eligible for all these batches by topmost educators of India. These are various plans available with us in the plus. These are various plans available with us in Iconic. These are various plans available with us in light subscription. In plus, you get only Unacademy. In Iconic, along with Unacademy, you will get Preparator also. In light, you get only test series. So these are the various plans. You can see the minimum, maximum, see the prices of various plans. Whatever plans best fitted to you, right? You can purchase that plan. But before purchasing, if you apply my code before payment, you will get maximum discount. Maximum discount 10%, at least minimum discount will also always given to you if you apply my code. So please remember the code. It is my surname Sachdev, SACHDEV, Sachdev10. So the summary is that this code is useful for all students. Those who want to take subscription, those who do not want to take subscription. Those who want to take the paid subscription, plus or Iconic, they will get discount on using this code. And those who do not want to take subscription, they want to watch only free classes. They can unlock the free classes using this code. So code is useful for all students, so distribute them everywhere. Thank you very much. Join me back on the app after 5 minutes at 12:30 to